So, when a patient is newly diagnosed with breast cancer and they are treated for that maybe very early breast cancer, hopefully it's a very early breast cancer, and all the cancer's gone, it's all been treated, and they're all done with treatment, we know that some fraction of those patients have cancer hidden away somewhere that are the ones that are going to regrow and cause problems. Now, where are those cells? We don't have any test today, like a CT scan or an MRI, that can pick up a very, very tiny number of cells. For a CT scan to be effective and identify something, the cancer really has to be like a lump, well, half an inch in size, or it's just not going to be seen. But a small cluster of cancer cells hidden away, we don't have a test for that. Now, that would be an amazing thing to have such a test. And so, one of the places that cancer cells spread to is in the bone marrow. And one of our main projects that we're working on is to try and develop a way to detect these very rare cells spread out in the bone marrow. And so what happens is that when a patient's asleep under anesthesia being treated for breast cancer, so they're asleep, we take a special needle and aspirate a tablespoon or so of bone marrow out, much like a blood sample, but it's done through a bone. And then we analyze and look for rare disseminated tumor cells. And the way we've done that is to use special markers for breast cancer cells that will show them brightly lit as green little tiny cells under a microscope that stand out amongst a kind of a sea of background white blood cells.